Hi everyone, my name is Isaac, and thank you so much for having me here. And on behalf of my research group, we are going to present this to you as Chair just mentioned. Many heterosexual women like me feel Mpox is not our business, so we are understanding the barrier to Mpox vaccination initiation and full vaccination in Taiwan Syndemic. So this independent research is founded by Taiwan CDC by the views of our authors and not those of CDC. So a quick overview of Mpox epidemic in Taiwan. And since 2022, almost 3 years, we have a total of 462 cases reported, and then all are clade 2B. And 2 of those 462 were assigned female at birth, and we have 1 mortality cases. So since 2023 May, we started a public funded vaccination program. And you can see Taiwan's here, 23.3 million populations, and last year we have 93 cases, and half past 2025 till now, we have 10 cases, neither of past the epidemic threshold. And so since the first PHEIC in 2022, and Taiwan government Taiwan and has delivered free 2-dose genus vaccine to Mpox vaccination priority groups. We call it MVPs, including people with multiple sexual partners, diagnosed with any STIs, people living with HIV, and HIV PrEP users. And this study is to explore individual perceived barrier to Mpox vaccination. So we hope people can really access Mpox vaccines to mitigate the negative impact and control the epidemics. So we conducted 12 semi-structured interviews for this rapid response project from February to September 2024. And we use a purposive sampling, but we try to ensure the diversity across gender identity, residential area, and HIV status. So we use framework analysis following the capability, opportunity, and motivation model and the socio-ecological model to present an overview for you. So this is table 1 summarize the 12 interviewees. As we always mention in mixed method of social science research, quality is also as important as quantity. And we will argue that you can see from here, almost half are aged 35 to 44, living in southern Taiwan, but we also include eastern Taiwan. If you came to the pre-meeting today, we know eastern Taiwan is a remote area in Taiwan. And in terms of gender identity, we include 1 cisgender woman, and the rest are cisgender men. Maybe some of you come in just for the title, but we want to let you know just because it's very difficult for us to recruit women who are willing to join a study to talk about their Mpox vaccination histories. And then most are non-heterosexuals. You can see 2/3 here are reported HIV negative, and the majority have at least vaccinated with 1 dose Mpox vaccine. And 3 of these 12 have infected with Mpox. So the key result first is what are the barriers and facilitators to initiate Mpox vaccinations? So we found out that the facilitator includes people who have the ability to search online information. At the beginning, you need to go online to book the time slots to approachable facilities, and then you need to find this is accessible to your places. And some users, they mentioned the social app, geosocial app they use. If you can show vaccination status of Mpox, that also help to give them a social opportunity to go vaccinated. And last but not least, the anxiety about the negative impacts which Dr. Yang has showed about, all the facial or genital appearances motivate people to want vaccination to protect their own health and avoid consequences of the stigma related to the facial stigma and the potential connotation implication of their sexual orientation. But there are lots of barriers. For example, people confused with Mpox with chickenpox, which some people believe they have got chickenpox in their childhood, so they should be immune, but which is we all know is not true. That also highlighted the limited literacy of the disease itself and the literacy of the vaccine efficacy. And at the beginning, there were some negative narratives on social media about the Mpox vaccination, also hinder people going to vaccine. And we don't see lots of positive norms about vaccination against Mpox. last but not least, because we know vaccination will leave scars on your arms. So people wonder if they have that scar being revealed by everyone, people will know they go to have the Mpox vaccination and have more, stereotyping of their behavior. So this is the key finding of our initiation of Mpox vaccination. But what about the barriers to full two-dose vaccination against Mpox? So we asked those 5 people who have at least immunized with 1 dose, and they come up with this 4 level of barriers. So from individual level, some believe that the low necessity and urgency for getting full vaccination. The person mentioned, like, if the first dose give me 70% protective power and the second give me 80%, I don't see the difference between 70 and 80. What's the difference? They can't see that. And also, people that will say 1 dose is good enough for me to protect from Mpox. We show from either HIV positive man and HIV negative man. At the interpersonal level, there has been contested norm of Mpox vaccination within people's social network. Particularly, only 1 of 12 interviewees in this rapid response research have heard the latest Mpox PHEIC last year. So this person mentioned, compared to 2022, this time none of my friends talking about Mpox. People don't care because we don't have new clade 1 Mpox cases in Taiwan, as if it only happens outside of the country, not really our business. And thirdly, to community level, if you remember the social ecological model, there have been community distrust of public health authorities. Like this person mentioned, when government tirelessly promote full vaccination, we wonder where those vaccines expire soon. So it's trying to clean up the stock, and then so it kind of conspiracy about the government's intention in promoting free Mpox vaccination. And the other one mentioned about healthcare potential discriminatory behavior from the institutional stigma. I'm hesitant to get a second second vaccines, as I might bump into the discriminatory assessor again. So that's make them feel a bit distrust, either for the healthcare provider or for the government. Last but not least, it is at a policy level, although our government has tried to provide gender-neutral Mpox vaccination policies, we found that gender and geographic disparity in accessing Mpox vaccines. In terms of gender disparity, this HIV-negative woman, age 30, mentioned, the way our government promotes vaccination against Mpox makes many heterosexual women like me feel Mpox is not our business. Many women hold themselves aloof because they rarely hook up. Either you agree or disagree. This is from the person, yeah. And also, geographic disparity shows here. I've never heard of Mpox vaccination outreach project in Eastern Taiwan, bracket the remote area, just because where sexual health resources are scarce. So you can see there are lots of disparity, either it's like gender disparity or geographic disparity in terms of the vaccination and access to vaccines. So our key conclusion here is, firstly, it's very important to engage with community, including people identifying as women, to consolidate their trust in Mpox vaccination and care. Secondly, based on our finding, it's also important to reiterate we need to use stigma-free languages and advertisement and materials in healthcare communication. I would like to use this one as an example. You can't see any gender stereotypes here. You can't see any male, female, or man, woman identifying here. Instead, I use more like a cartoon style, more relaxing, and to tell you but it's in Mandarin. So get Mpox vaccinated, and then you get bonuses, and you get more lucky, and then you can scan a QR code to get a free flight ticket to Bangkok, even if you just join the prize draw, right? So, I mean, this is a way to normalize it. So that's why I want to bring the last but not least is to sustain. We need to sustain efforts on science media communication, which is the health communication, by normalizing Mpox prevention and acquisition. When we say normalize it, it's not just focusing on specific sexual orientation or specific gender, but using it as a way to talk about travel medicine, talk about when you come into different countries, please take Mpox vaccination as a prevention as you go to all kinds of countries. And we need to tackle mis or disinformation about Mpox vaccination, about the potential worry of the side effect or the severe adverse effect. Last but not least, for countries who never had self-care guidance, please generate them. Please try to advocate your government to say, people try to self-care maybe. They just don't report. You don't see a case that doesn't mean it doesn't really exist. And if you have the guidance, please improve them to update user-friendly Mpox self-care guidance and the vaccination strategy. So we thank you very much, and lovely people is all my group, and thank you.